I'm sure everybody would echo is the bright light that has been shown on issues related to health disparity and the absence of a really profound health equity.
BusinessJournalDaily.com 3 Minutes With is brought to you by Farmers National Bank.
In an effort to eliminate health disparities and to really achieve full health equity for our pediatric patient population, we recognize that that's not any single hospital or any single practice working independently. That's got to be built on partnerships with community nonprofits, partnerships with public health, partnerships with schools. And so we are really enthusiastic about the fact that there is, we think, a brighter light and a little more direction, a little more urgency provided towards solutions around health equity. And we're really excited to partner on work in those areas.
Just knowing people in our community and talking with them, there are a lot of people that have lost many lives. We have seen just recently, our own former council person, Artis Gillum, who lost his life to COVID-19. And so we are lucky here to have our Office of Minority Health, and that we have been working with our patients and our residents to try to get into the neighborhoods. And that's why when we started our working for testing, we went into all the communities. So each side of town, we would try to get to each week so that people that lived in those neighborhoods could come and be tested, as opposed to, having to go and get in a car or get on the bus and get to somewhere.
A big challenge that I've been trying to understand is how can we collectively as a community reestablish and gain trust, particularly of disaffected communities and groups. I think in order for us to succeed in the mitigation and for us to succeed in the vaccination campaigns related to COVID-19, it's essential that we earn trust.
What I've learned from this and what's come out of this is truly a wonderful partnership between health systems and public health. We had it before, but I think it's only been doubled down on that. So working with health commissioners and multiple different areas of cities and counties, and also health systems working together very openly about what we're doing to share on information concerning COVID-19 and our present state. And then I also think it did shed a light on public health and the importance of that. We've always had it. It's always been in the background. It's always done vaccines and inspections of restaurants and landfills. We've always had that, but I think this has raised the public perception of what public health is and the importance of that. And I think that won't go away.
The issues that have come to us, that have exacerbated here in our county have been the attention to the rural community, in which we have a lot of folks that are isolated, that were generationally affected by poverty. Those issues really surfaced for us because as the pandemic evolved, we saw the economic disparities. And so a lot of our folks wrestled with many issues related to the impact economically. Initially, we saw a lot of that. And then obviously the access to healthcare in a rural community. We have access points, but with barriers like transportation, insurance coverage, and those kinds of barriers, it made it very difficult for some of our rural community that lives in poverty.
This was something new that was for the schools, and for them to actually take direction and build a relationship with public health proved, as schools were starting to get back in place, that they wanted to listen to public health, build a relationship, and ensure that our kids were going back, not only to ensure safe instruction, but to ensure that if there was a case, that it wasn't going to be brought back into the family homes.
How can we, as an example, take advantage of the pilot program in Ohio to allow SNAP recipients to use their benefits to order groceries online? There's a small number of retailers that are allowing this. How are we potentially able to make that more permanent so that more individuals more frequently and longer term are able to use those benefits to make sure that food access is not something that folks continue to have to work through? We know that that's been an issue in the Valley before the pandemic and certainly the pandemic. And COVID-19 has, as many said, shown a light on some of those disparities and issues.
Thanks for watching the video. Be sure to like, subscribe, and hit that little bell for notifications. And also make sure to connect with us on Twitter, Facebook, and LinkedIn. For all of your business news, visit businessjournaldaily.com. For all of your arts and entertainment news, go to afterhoursyoungstown.com.
BusinessJournalDaily.com 3 Minutes With is brought to you by Farmers National Bank.
I like a bank that's a pillar in my community.
I like a bank so cutting edge, they have a lab branch.
We are so alike.
Well, we do both bank at Farmers National Bank.
Farmers.
Stand strong.